The signs and symptoms of peripheral vascular disease could be very confusing. The typical symptoms of peripheral vascular disease includes a feeling of heaviness or cramping in the calf muscles or in the thigh area or in the buttock muscles when patient is walking. Those are the typical symptoms. However, what we do know, these typical symptoms are not so common. A good majority of patients who have peripheral arterial disease do not feel the same way that I just described. The other symptoms of peripheral arterial disease include just being unable to walk, weakness in the muscles when the patient is walking. There are some patients who would have this very uncomfortable pain in their feet, and they feel that specifically when they are sleeping, that may wake them up during nighttime. There are other signs such as ulcers or sores that are not healing, that you can see them in the toes or in the feet or around the ankle. There are other signs such as loss of hair and feeling cold and numb in the feet. Another sign in men is erectile dysfunction. And if anybody has any of those symptoms, I would encourage them to talk with their family doctor or with their cardiology or vascular medicine specialist to discuss those symptoms and see what the next step would be. Because if they do happen to have poor circulation in the leg and they also have a sore or ulcer in the foot and ankle that is not healing, they would be at risk of losing their leg. That is why the American Diabetic Association recommends an urgent evaluation by a vascular surgeon or a vascular medicine specialist to determine the presence of peripheral arterial disease and to provide treatment for it.